I'll tell you some facts about the history, actuality, and future of drug consumption rooms in Switzerland. Switzerland has more than 25 years of experience with this approach. It's hard for Zurich, but the first drug consumption room, like Ingrid already told, was opened in 1986 in Bern, in the capital city. Now we have 13 drug consumption rooms in 8 cities, most of them in the German part of the country. In my presentation, I will have the focus on the situation of Zurich, because Zurich had the biggest open drug scene of Switzerland or even Europe at that time. By the mid-1980s, Switzerland was facing a growing drug crisis. Around 15,000 drug law offenses were recorded every year, with no sign that law enforcement had an impact on the supply and use of illicit drugs. Drug-related crimes, crime was rapidly increasing. 1986, people who used drugs in Zurich, mainly heroin, settled in a park. That park became Zurich's infamous Needle Park. That time, there were 30,000 people with an opioid disorder and 700 people annually dying from overdose or AIDS in Switzerland. The open drug scenes were lawless areas with violence, gunfights, and excessive deal. About 600 drug users per year were infected with HIV and hepatitis C. Between 5 to 10 artificial respirations per day and approximately 80 drug-related deaths in the city of Zurich per year, in a city with about 380,000 inhabitants in the early 90s. The medical officer of the canton of Zurich, which is the state of Zurich, threatened to revoke the license of doctors and pharmacists who provided sterile injection material to people who use drugs. After a petition of 300 doctors, the parliament authorized these measures. After that, they distributed roughly 6,000 syringe and needle sets per day. Switzerland's four-pillar policy. The pressure to act became enormous. For this reason, a pragmatic solution beyond party ideologies was found with the four-pillar policy. The four-pillar drug policy is the core of the national drug strategy. It enjoys now a wide support from the public. In 1993, UN bodies reminded the Swiss government that harm reduction programs are not substitutes for demand reduction programs. They received some heavy criticism at the international level. The position on safe injection facilities has evolved positively over the years. The International Narcotic Control Board annual report for 2016 mentioned for the first time a clear recommendation in favor of this approach. Since 2008, a revision of the narcotic law was accepted by 68% of the population. Harm reduction was now fully institutionalized and is one pillar of the Swiss four-pillar drug policy, which includes prevention, treatment, law enforcement, and harm reduction. Quite an interesting fact is that almost half of all the patients who have access to heroin-assisted treatments worldwide live in Switzerland. Harm reduction includes safe injection facilities, welfare, housing, and work programs. The principles of drug policy in the city of Zurich are compliance with the urban environment and not abstinence, maintenance of public order, integration of drug users, and the Swiss four-pillar policy, which includes cooperation and coordination between social work, police services, and medical assistance services. Harm reduction prevents a visible drug scene in the public area. They contribute significantly to the maintenance of public order in the city. The quality of life of the neighborhoods increases enormously, as the negative effects of an open drug scene are minimized due to various measures in the area of harm reduction. Safe injection facilities. Our facilities offer drug consumption rooms for injecting, smoking, and sniffing drugs. 1/3 of the clients inject drugs. A few people sniff, and all the rest they smoke it. We have meeting places, recreational activities, and medical counseling. First aid, exchange supply with syringes and needles, personal single case work, laundry, showers, class exchange, and also work opportunities. We have some peer working programs like the so-called mediation program. Several drug users change syringes in private drug consumption rooms in the city where we don't have access because we don't know where they are. They get paid for that preventive work. Further, we start next week with a drug testing project in the safe injection facilities in Zurich and Basel, another city in Switzerland. This will give us the chance for monitoring the drug market, and drug users get information about what exactly they consume. This is a city map of Zurich. You can see the 4 locations of the facilities. These are chosen very carefully. Furthermore, the opening hours are set in a way that individual quarters are not burdened permanently. We have 2 in the city center and 2 in the suburb. 1 location is closed since April 2018 because 3 facilities cover the current demand. The yellow point is the location of the former so-called Needle Park, just next to the train station in the city center. These are some facts and figures. We have approximately 800 people use these facilities in Zurich. It's different to Amsterdam. Yeah. The average age is about 48 years. We count approximately 22,000 consumptions of illicit drugs per month, and we have around 70 employers which share 32 full-time jobs. 50% of them are nurses and 50% are social workers. We supply around 150,000 syringes per year. Very important for us is the collaboration between harm reduction and law enforcement. The Drug Investigation Police has the following strategic objectives: managing drug markets and not eliminating drug dealers and not consumers as primary targets, focusing on high-level dealers and organized crime, not low-level dealers, reducing drug-related crimes, public safety and order, and no public dealing and drug use. We collaborate very close. Employees of the safe injection facilities absolve internship at the police department. An internship in a safe injection facility is obligatory part of the police school. Employees of the safe injection facilities are teaching at the police school as well. The neighborhood and local community, the sensitivity towards the clientele is still present. Individuals are sometimes afraid. In case of complaints, we seek constructive dialogue and take effective measures. We have an intensive dialogue with neighbors and the community and keep the surroundings of the safe injection facilities clean. Now some challenges in future. More and more clients with dual diagnosis are difficult to take care because of their violent behavior. Therefore, we actually develop our conceptions. Another challenge is the demographic trend, which you can see on the graph here. People get older and are often in need of care. For example, a 50-year-old drug user is often in a health condition like a 75-year-old man. This will be a challenge for us, for our health system in the next years. Like I told, the average age is about 48 years. In 2008, 11% were younger than 30 years old. In 2017, it was only 1%. This is a very positive development. There are only a few newcomers. And on the other side, I'm probably going to lose my job in 10 or 15 years. Now more than 80% of our population is older than 41. Other challenges are clients, our young clients, pregnant women and parents. They get consumption restrictions and we attend them very close. We also work together with the Child Protection Authority. And at the end, harm reduction measures have a very positive impact. As the analysis of a study by the University of Zurich and others shows, without the protective measures taken in 1988, there would have been more than 15,000 additional HIV infections and more than 5,000 additional AIDS deaths. However, preventive efforts in Switzerland have not only protected thousands of people from HIV infections, but also paid off financially. The cost per year for the treatment of one patient amounts more than 20,000 Swiss francs, which is about 18,000 euros. Therefore, the prevention of 15,000 infections made savings of 340 million Swiss francs, about 280 million euros possible each year. Introduction of harm reduction 2 years prior to 1988 could have halved the epidemic and preventing more than 3,000 HIV infections and 1,400 AIDS deaths. You have the link on the slide here to the study. Thank you for listening. I'm at the end.